Assalamualaikum doctors. In this video, I'm discussing about Beckwith-Wiedmann syndrome. So the Beckwith-Wiedmann syndrome, some important features from this picture we are seeing. There is macroglossia in large tongue. There is a lateralized overgrowth, that is hemihypertrophy, umbilical hernia, look the umbilicus. There also we find like surgery occur for omphalocele gastroschisis. These are ear creases. Look the ear, there is a ear creases present. Facial nervous simplex. These are the features of Beckwith-Wiedmann syndrome. In large tongue where we find also macroglossia with Beckwith-Wiedmann syndrome we find, Down syndrome we find, and spinal muscular atrophy you find tongue fasciculations. These are we find there is tongue issue. Okay. So when we start examination of a Beckwith-Wiedmann syndrome, generally you find tall, obese, plus minus submental, according to neonatal hypoglycemia, if it affects him or not. And special phases, normal puberty. So tall and obese, submental plus minus. Features from the gait and back, what we find, hemihypertrophy, head and neck. So hemihypertrophy. Transverse groove in the ear, large tongue, port 1 stain, head circumference measure. There is large tongue, port 1 stain, head circumference measure. Abdomen we find abdominal wall defect, hepatosplenomegaly, Wilms tumor. So abdominal wall defect we find, and the umbilicus is very important, hepatosplenomegaly, Wilms tumor. Diagnostic criteria of Beckwith-Wiedmann syndromes. For diagnosis, 3 major criteria or 2 major criteria, 3 or more minor. Major criteria of Beckwith-Wiedmann syndrome are macrosomia, macroglossia, and abdominal wall defect. And the minor criteria AR sign, there is transverse groove, facial nevus flames, hemangioma, hemihypertrophy, and hypoglycemia. I would like to complete my examination by complete developmental assessment to see whether hypoglycemia affects his growth or not. I would like to ask the mother about birth weight, neonatal hypoglycemia, other member in the family with the same condition or not. It is a chromosomal 11. So developmental assessment we will do. I would like to complete and ask the mother about the birth weight, neonatal hypoglycemia. What is the investigation for Beckwith-Wiedmann syndrome? First of all, diagnosis clinically according to major and minor criteria, but I would like to do genetic testing. So we are doing genetic testing. Left tumor marker till the age of 4 years. He is obese, so random blood sugar, total lipid profile, liver function test, insulin level. Imaging ultrasound of the abdomen because hepatosplenomegaly until the age of 8 years. CT of the abdomen for tumors, echo, core pulmonary obstetric sleep apnea, and 10% have cardiac lesions. Plus sleep studies for obstetric sleep apnea. So these are the investigation we are doing. Diagnostic genetic test we are doing. Tumor marker we do. Obesity, all the tests like random blood sugars, lipid profile, total lipid profile, liver function test, insulin level. Imaging ultrasound of the abdomen, hepatosplenomegaly until the age of 8 years. CT abdomen for tumors, echo for coropulmonal, obstetric sleep apnea, and 10% have cardiac lesions. Plus sleep studies for obstetric sleep apnea. Common tumor in Beckwith-Wiedmann syndrome, easy to remember, Wuhan. W for Wilms tumor, A for adenocortical carcinoma, H for hepatoblastoma, N for neuroblastoma. Again, Wuhan. Wilms tumor, adenocortical carcinoma, hepatoblastoma, and neuroblastoma. Manage them according to problem list we will manage. So what is the management plan? Let's see. First of all, macrosomic baby, so surgery needed, obesity related complication, obstetric sleep apnea, if hypoglycemia, any fits, convulsions, neurologist, anti-epileptic medication we are giving, abdominal wall, any defect, do surgery, abdominal tumors, oncologist involvement. I will do the vital heart rate, respiratory rate, dehydration, stabilize the patient, if need oxygen, correct the dehydrations, bedside random blood sugars. So first any patient we will check the vitals, revise the note, check the vitals, heart rate, respiratory, dehydration, stabilize the patient, if need oxygen, correct dehydrations. These are we will do. Bedside we are doing random blood sugar test, and the according to problem like macrosomia, so surgery, obesity related complications, obstetric sleep apnea if present, hypoglycemia if any fits, convulsion, neurology involving anti-epileptic medications, abdominal wall, any defects, do surgery, abdominal tumor, oncologist involvement. So note, Wilms tumor associated with disease are Beckwith-Wiedmann syndrome, hemihypertrophy, that is Russell-Silver syndrome, NIDA, Drash syndrome. Drash syndrome features are ambiguous genitalia, nephropathy, Wilms tumor. Important D with specific criteria. So these are what are the criteria? Beckwith-Wiedmann syndrome criteria very important. Neurofibromatosis 1 criteria very important. Rheumatic fever we know that, Jones criteria. Infective endocarditis modified Duke criteria, and psoriatic arthritis Vancouver criteria. These are very important. If Beckwith-Wiedmann syndrome come on video station, what history will ask? Like about the delivery, any obstructed delivery, difficult labor because they are macrosomia. About birth weight, hypoglycemia is very important. Abnormal any movements. about the random blood sugar level during birth, mother diabetic or not, heel prick test done or not, other member in the family has the same conditions because it is a chromosome number 11 disorder. So this is all about Beckwith-Whiteman syndrome. Thank you.